I'm Deacon Jim Vargas, President and CEO of Father Joe's Villages, the largest and oldest homeless services provider in the county of San Diego. Thank you for joining me in this important discussion. Today, I'm going to be speaking with two candidates who are vying for the office of County Supervisor for District 1. Here in San Diego, over 9,000 individuals on every given night are challenged by homelessness, almost 60% of whom are in shelter. We're going to be focusing in our discussion tonight, especially on housing and behavioral health. Let's get started. Mayor McCann, thank you for joining me. I really appreciate you taking the time. I know you're very, very busy. Why don't you start by just telling everyone who you are?
Well, first, thank you for having me. I really appreciate your time, and I really appreciate what St. Vincent de Paul's does to help the homeless. I'm John McCann, the mayor of the city of Chula Vista. I'm a lifelong South County resident and Chula Vista resident. I'm married to another South County lifelong resident and Chula Vista resident, Missy. We have 4 children. I'm a Navy veteran and been very fortunate to be able to serve my community as a council member for 4 terms, and now as the mayor of the city. Chula Vista is the second largest city in the county, and we've really been able to escalate and upgrade so many things in the city of Chula Vista. We've been able to bring in the new Gaylord Pacific project, creating over 7,000 jobs for construction, and then thousands of jobs permanently. We've been able to make the city of Chula Vista a #1 safest city, and it's one of the safest cities in the county, the state, and in the United States. So public safety has been a huge priority, and I've taken on the regional leadership. When I was a young council member in the early 2000s, homeless really was not an issue. And if there was a homeless issue, we would then go ahead and call the county. But there's been an epidemic, and since I've been mayor, I've been very fortunate to be able to work with different organizations to be able to decrease the housing, not just in the city, but regionally, and been very successful at that. But that's about me, and I just love Chula Vista, the South County, and I'm here to serve.
Oh, great. Well, Chula Vista is a pretty place, pretty city. So thank you for that. And you touched upon homelessness, and the rest of our questions are going to focus on just that homelessness, right? And you're vying for the District 1 seat actually, and Father Joe's Villages and Vincent de Paul Village falls within District 1. So obviously we work very closely with the county supervisors as a whole, but particularly with the supervisor of District 1. In the last almost 3 years actually, there's been, I'll call it a phenomenon happening, and it's been reported by the Regional Task Force on Homelessness, where with the exception of a few months, more people have been falling onto the streets on a monthly basis, countywide, that have been able to be helped into housing. Obviously, that's a striking statistic, right? And the fact that it's happening over and over again. What do you suggest be done in order to address this?
Sure, I think it's several things that we need to do. I've been working with the different mayors throughout the county. Homelessness is a regional issue, and many of the homeless you see becomes very transient. And what we've done is we created a homeless shelter, a tiny home shelter. We've then created our homeless outreach team that goes and integrates and talks with the homeless individuals on a regular basis. And then we also created a homeless encampment ban to make sure that, again, if they would like to get off the streets, we have the ability to give them opportunities to go to different shelters, to get wraparound services, to be able to help, to get back on their feet, and then transition into permanent housing after time. But the reality is that if they are not wanting to get help, we just can't have them stay in public spaces, and we have to be able to give them an incentive to be able to stop doing drugs, and being able to have them get back into a great place to be able to get help.
Well, it's interesting. You touched upon individuals who have challenges with substances, as an example, and that is the case. And others have challenges with mental health as well. And so, behavioral health is a very key component. I know it is for us here at Father Joe's Villages and the work that we do. And so, knowing that it strikes so many, is such a large percentage, and we estimate anywhere between a third and 40% of those who are mired in homelessness have some level of substance use or mental health challenges. What do you suggest we do as a region as it relates to behavioral health? How can we help these individuals?
That's a great specific point. Homelessness is not a one size fits all. You have people who have substance abuses, you have people who have mental health issues, people who have financial challenges, family issues, so many different things, as well as a combination of potentially parts of those too. And what I believe need to happen is the county has to do a better job at taking a leadership role in being able to work with the nonprofits, whether it's the Rescue Mission, St. Vincent de Paul's, the veterans, being able to make sure we identify what are the needs of that individual and being able to find the most impactful place for them to be able to get help. Obviously, we want to make sure they get off the streets, but we want to make sure they actually get help, because I want to focus on long-term solutions. I don't want to help somebody just get a voucher and stay in a motel for a weekend and then get back out on the street. We need to be able to find long-term solutions. And I think the county needs to be able to leverage the hundreds of millions of dollars it receives to be able to focus on key things that actually get people off the streets and get them into places where they will be able to get help and get off the streets. I applaud St. Vincent de Paul and other nonprofits that have been very effective at being able to get people off the streets and then get them help for whatever their issues are for being homeless, and then ultimately getting them into permanent housing and back on their feet. And that's what we need to do. So I would, especially as the District 1 representative, lead to be able to get together, put together a steering committee to be able to talk about how do we actually get this going on. I love people. I want to make sure that we get them help. And I want to make sure we're not just enabling people to stay on the streets, because it is unsafe and not a good situation to have people on the streets for the long term. We need to find quality solutions to give them wraparound services that will get them off the streets long term, not just for a weekend.
Thank you for that. And in fact, the county right now is working towards establishing its next fiscal year's budget beginning on July 1st. And I'm sure you've heard that they are grappling with this, right? What are they going to do as it relates to prioritizing the funds and maybe even dipping into reserves as a possibility? I mean, we don't know whether that will actually happen in response to the fact that the federal government, we hear, is cutting more and more services, right? So I'd like to hear your thoughts about that, actually, as now coming into, if you were to come into district as a District 1 supervisor. I mean, what do you think about those budgets? How should the Board of Supervisors prioritize those precious dollars, especially as it relates to potentially tapping into reserves?
Sure, I am very opposed to tapping in the reserve funds unless it is an emergency or some type of crisis or a major economic downturn. So that is something we need to be able to not do. Over the last several years, the county has actually seen a decrease in population, yet they've hired over 2,500 employees and increased all these different departments. So we need to get back to a balanced budget. Right now, the county is $139 million budget deficit, and that over the next couple years will balloon to over $300 million. And that is unsustainable, especially if you start tapping into the reserves. If you want something sustainable, you need to be able to make sure you have that balanced budget. And one of the main missions of the county is health and human services, not the cities, but the county. And again, when I was a young council member, again, in the city of Chula Vista, when there were health and human services issues like homeless, we would then communicate with the county. But the county hasn't done as good of a job over the last several years in combating some of these health and human services issues. So we need to get them focused back on being able to make sure that they're helping homelessness. Again, not just enabling them, but making sure that they get off the streets. And the reality is as the mayor of the city of Chula Vista, I have led for fiscal responsibility. The city of Chula Vista has been one of the only cities in the state of California that has had a balanced budget, no service cuts, fully funded reserves, and no layoffs. And I will look at being able to make sure that we are going to have a balanced budget and a sustainable budget so we can focus on the importance of the mission, like the health and human services, like getting people off the streets. And the reality is there's too many pet political projects that has been getting a lot of money, and they might be nice ones and people might like them, but the main jobs and the main functions of public safety and health and human services need to be funded first before you do the nice to have items.
Oh, thank you. Thank you for that. You probably have heard me say, I know I say it quite often, that it's wonderful to have these shelter beds, and we have hundreds of shelter beds at Father's Children's Villages, and they're very necessary. It gives us the opportunity to take people off the streets in immediacy, help them off the streets, and then provide the services and programs that they need in order for them to become self-sufficient. That said, I've said time and time again that a shelter is not a home. It's a temporary stopgap, right? A home is affordable housing. And, you know, we don't have enough affordable housing in this town. When I say this town, I mean the county as a whole, right across the region. And it's very expensive to live here. We have one of the highest cost of livings in the United States. Inflation, right, wreaks havoc on individuals. In fact, people have just been hanging on by their fingernails, right? Suddenly, because of the higher cost of gasoline and milk and eggs, it's causing them to fall onto the streets. Our food pantry, by the way, is growing by leaps and bounds. The cars that go around the block, right, coming in for that extra assistance. And I'm glad we're able to provide that extra assistance, but it points to the fact that people are just hanging on by their fingernails and falling onto the streets. So talk to me about affordable housing, right? We're affordable housing developers as well at Father Joe's Villages. That's what breaks the cycle of homelessness. That's a home, is affordable housing. I'd love to hear your thoughts on that.
Yeah, that's a really good point. When I grew up in the city of Chula Vista, I was raised by my single mother. So was my sister. She was a factory worker, single mom that worked at the Aurora Aircraft Factory. And we were very, very poor. And I remember we had a jar that we would put coins in. So if we ever wanted to go somewhere, we could use those coins to pay for a gallon or two of gas to be able to do something. So believe me, I understand and feel the challenge of being able to live in San Diego County. We are one of the highest priced areas in the entire country. And what we need to do is be able to create affordable housing. The first thing is we need to, currently the county has $1 billion tax increase. And part of that tax increase is to put additional fees and funds or taxes on the purchase of housing. And that would only increase housing as housing continues to rise. So I would be very opposed to that. I would be opposed to the $1 billion tax increase. We need to be able to focus on several things by decreasing the cost of living, And how do we do that? By making sure that we don't increase taxes, especially on our working class individuals. And we need to be able to create additional housing. I am a finance guy. I have a master's degree in economics, and it's a supply and demand issue. The more housing we can go ahead and provide, the decrease in the price of housing, because we have not been able to keep up with our growth. With the city of Chula Vista, we've been one of the only cities that has been able to build a substantial amount of housing over the years. And since I've been an elected official, we've built the entire community of Eastlake, San Miguel Ranch, of Rolling Hills, and we're still working on Otay Ranch, continuing to build villages there. And we are building all the way from housing for people who are in the mailroom all the way to the boardroom. And we want to make sure that we are providing additional housing and to be able to help people get off the streets. And working people should not only be able to have quality, affordable housing, but also I've been a huge advocate of home ownership. If you're a nurse, if you're a police officer, firefighter, teacher, you should be able to buy a house in the city of Chula Vista. And I've had several initiatives to be able to put, in the last couple of years, over 1,000 entry-level home ownership opportunities on there. When you allow people then to move up into home ownership, that then allows more people to get into those units, more affordable units that are rental units. And so right now we need to make sure that we're expanding the number of housing opportunities, whether it's rental, but ultimately, hopefully, for most people, the American dream to be able to buy a house, buy a piece of property, to be able to create stability, to be able to invest in the city, and to be able to build generational wealth.
That's great. That's wonderful. Thank you for that. In closing, any final remarks?
Yeah, I have, as the mayor of the city of Chula Vista, I have been a regional leader on homelessness. The reality is that homelessness has become an epidemic issue. And it originally was the county with the Health and Human Services. Because of many reasons, that went ahead and was pushed down to the cities, whether it's the city of San Diego, the city of Chula Vista, or other places. So as the mayor of the city of Chula Vista, I had to step up, and we had to do it regionally, because it is not just one area has the ability to have homelessness. People migrate. When they do something in San Diego, many times they just take the trolley down to Chula Vista or go other places. So what we've done is we've put together a comprehensive strategy to be able to get homeless off the streets. And we've had hundreds of individuals that we've not only helped get off the streets, but been able to get them into the right location or shelter to be able to get them wraparound services, to be able to get help. As the mayor and prior as the council member, we created the homeless outreach team. We then were able to build the tiny homes village with 65 units of getting people into wraparound services, into the shelter, bridge shelter. To get in there though, you had to be clean and sober. If you weren't, we would allow you to go to detox, be able to get you in there. But we had a high barrier, and other places didn't. But we want to make sure you're fully committed if you do want to get help, and make sure that we can be successful to get you off the streets. And then ultimately, we did pass a strict homeless encampment ban. You can't just be in a park. You can't be in public spaces. We want you to find a place where you can get an actual bed, be safe, and be accountable to be able to move towards getting off your streets. So we've been able to not only help people in the city of Chula Vista, but the entire region. We've been able to take homeless off the streets in National City, in Imperial Beach, in San Ysidro, Barrio Logan. We've been a regional leader, and because of that, I would just be very fortunate to get on the county because I have the experience in the leadership to be able to help homelessness at a higher level.
Well, Mayor McCann, thank you very much. You've been very gracious with your time and with your responses. I really do appreciate it. Mayor Aguirre, thank you for joining me. I really appreciate it. I know you're busy, especially this time of year in the upcoming election. And so I appreciate you taking the time to speak with me. And the topic today is going to be homelessness. And Father Joe's Villages, that's what we do day in and day out. We take care of those who are on the streets. Why don't we start by you telling us a little bit about yourself, right? And your priorities and the like.
Sure. So I am the proud daughter of Mexican immigrants who waited tables for a living. I am the first person in my family to graduate college. I first moved to the area in 2001, and I fell in love with Imperial Beach, with its people, with its waves. I'm a surfer. So knowingly, I had been surfing in polluted water for many years, and that's how I became involved in the fight against the sewage crisis, which it's been ongoing for at least 20 years. It's one of the primary reasons why I ran for office in 2018 and later as mayor in 2022. Very proud of the fact that we've made progress on that front. Proud of the fact that I'm the first Latino ever elected to a city that's 52% Hispanic. And now I not only get to work on this existential threat that is the sewage crisis, but also on other existential threats such as housing, housing affordability, and homelessness and behavioral health, which are big priorities for me, even during my time on council, but now even more so pursuing the District 1 seat, which represents, as you know, 650,000 residents of South County that for far too long haven't gotten the fair share.
Hmm. Well, thank you. And in fact, Father Joe's Villages is within District 1. So we depend upon the county supervisor there as well. So we're very interested. So in the last almost 3 years now, I'll call it a phenomenon. Something has been happening that hadn't happened before, and that's that each and every single month, more and more people are falling onto the streets than are being helped into housing. And those are statistics that are managed by the Regional Task Force on Homelessness. And with the exception of a few months, almost for 3 years, on a monthly basis, we've seen this phenomenon. What do you think needs to be done to address that?
Well, first and foremost, thank you for all the work that you and the organization does, because it's critical work. It would be a much worse situation if you all weren't working on this. But sadly, despite this ever-growing number and all the investments, billions of dollars, really, we haven't seen as much progress as we would like to see. And I think that many, not myself, but many attribute homelessness exclusively to addiction or mental health issues. And I believe this is a systemic, much broader cause. And I think tied to it very closely is the issue of housing affordability. The statistics are there. We know that a large portion of our unsheltered residents are local. They don't come from other places. They're here, and it's because they lost a roof over their head. That's why, for me, it's so important to keep people housed, and obviously put people into housing if they're not housed. So one of the areas that I want to focus on in the district and on the County Board of Supervisors is increasing housing affordability and making that available to all income levels, not just the wealthy. But we've seen this movement of wanting to build only these $1 million homes with 3 bedrooms and a white picket fence that Yes, we all should strive towards that American dream of home ownership, but the reality is nobody can afford that. We've seen the statistics as well that you have to make at least 270 plus $1,000 annually to afford one of these homes. So where I see the crisis is we're not building enough homes that are for affordable for working families. We're not seeing median income level housing or workforce housing, and even much less low to very low income housing. That's why I'm proud of the progress we've made. Even though we're a very small city in Imperial Beach, we've made big strides in our own capacity. We've approved the Wakeland project that you might be familiar with, which will provide housing for up to 50 seniors, and will have wraparound services, and will hopefully keep 50 people off of living on the street. So that's the type of those are the types of projects that we need more of county-wide, in addition to everything else that we're already doing.
Right. Well, thank you. And you're right. I mean, we provide lots of shelters, and a shelter is a stopgap, but a home is something that you have a key, and you can open a door, and there, that's where you're able to live, and that's really what breaks the cycle of homelessness. So, thank you for that. The behavioral health is a big issue as it relates to those who are on the streets. We estimate that about 40% of those who are homeless have some level of behavioral health challenges, whether it be on the mental health side or on the substance use side. So it's really a crisis for the community as a whole, actually. How would you propose that be addressed?
Yeah, and that's such a true statement there. We need a lot more behavioral health investments. We have a huge need, especially in South County, with such limited number of behavioral health beds at our local healthcare facilities and hospitals. The most recent report states that we need up to 14,000 behavioral health staffers by 2027, as you well know. So there's a huge need. We need to make sure that we enter into expanded partnerships with our hospitals and behavioral health care providers that are already existing, so that we can increase the number of behavioral health beds. We need to make sure that we have continuum of care, which is a big issue when people have to go to the emergency room in search of acute care. That's fine, but when they're ready to be promoted to continuum of care or other types of treatment, like addiction treatment or access to a behavioral health care provider, there's a big gap there. And that's where the county needs to step in and offer those services. And we won't be able to do that unless we have much stronger partnerships, so that we can increase those numbers of behavioral health beds, behavioral health providers, and that these folks can get into this continuum of care and eventually have the tools and resources available to them to get back on their feet, get them into transitional housing, and then hopefully into permanent housing.
All right. Well, you mentioned the county, and the county has been the supervisors have been discussing of late, potentially tapping into reserves, especially because we know of the uncertainty of federal funding as an example, right? And so that's been how impactful that will be to our community here in the county of San Diego. I mean, what do you think about that? What about tapping into those reserves, right? Being able to access them for behavioral health needs as an example.
Yeah, and for your viewers, I know you're being very diplomatic, but I don't need to, in the sense of those cuts are coming because of the Trump administration. We need to be very clear about that. The big, beautiful bill that's being already approved by the House of Representatives in Congress included gutting Medicaid and SNAP and essential services, essential programs for essential services that over 40% of District 1 representatives rely on. So that's why we're going to have limited federal resources. It's creating chaos. And in my opinion, the county should step up and bridge that gap that is being caused by the county, by the federal government. we have a responsibility to ensure this health, safety, and welfare of our people. And if that means tapping into our rainy day fund because of the storm that is being created by the Trump administration, I have no problem doing that in a fiscally responsible way. And that's the big difference between my opponent and myself. He keeps saying that, I want to increase taxes. That is not true. I want to just state that again for the record, which I've stated many times. But I am in favor of changing the very conservative policies of our reserves, because those reserves are not our money. That's the people's money. Those are taxpayer dollars that are sitting in a bank somewhere, accruing interest at the cost of working families back. So we need to make sure that we offset some of those cuts that are coming down temporarily until things change at the federal level, and we can replenish those programs that are being cut like a chainsaw.
Right, right. Well, then you mentioned what we've been talking about, behavioral health and detox as an example. We know that more and more people, unfortunately, are dying on the streets in the hundreds at this point, and a fair percentage of those are from drug overdoses, right? Fentanyl and xylazine and the like.
Yes.
So it's wreaking havoc on our population on the streets. So, having a method for detoxification, what do you think about that? To be able to have programs in place, which is a form of behavioral health, obviously, within the county itself.
Yeah, we need to have more, those services available. We need to have more crisis stabilization units. We need to have more training, and that's been happening already. It's been happening under the leadership of District Attorney Summer Stephan, I've collaborated with her doing educational forums. We've seen the number of fentanyl overdoses decrease because of a lot of that educational work, especially around youth that are very curious about trying drugs for the first time. But that doesn't mean we don't need to also tackle the source, right? We know where the source is coming from. We need to make sure we stop it at the border and work with our law enforcement partners to continue to curve those numbers down. But at the same time, there needs to be preventative interventions, which are through education, and also acute responses like these detox services, and also crisis stabilization units that are mobile countywide, so that we could better address some of these acute symptoms that folks may be experiencing because of drug overdoses.
Right. And you mentioned prevention when you mentioned affordable housing. Tell us a bit about prevention. How is that, or why is that so important in the total battle, in a sense, of tackling this challenge of homelessness?
Well, because it costs, if you want to look at it from a dollar and cents perspective, because prevention is a lot less expensive than later interventions. It costs us so much less money to be able to invest in, for example, in affordable housing than in putting someone who's already on the street, who's having potentially a number of different quality of life challenges. It takes so much more effort and so many more resources to put that person back, help them get back on their feet first, and then put them into housing. So prevention is key, and it's something that is missing in this conversation, in my opinion, because we oversimplify it when it comes to housing, and we just make it seem like, oh, it's just housing production. We just need supply so that we can reduce demand. Well, there's caveats and nuances to that. Yes, supply needs to be increased. Yes, but at all levels. And this fallacy that developers, that it doesn't pencil out for them to build affordable housing or workforce housing or low-income housing, I think that needs to be broadly discussed and tackled, frankly, because that can't continue to be just the excuse to not build affordable housing.
Right. Well, and even utilizing the current affordable housing, right? Keeping people housed now within
Oh,
their means.
yeah, that's a
So that,
whole different prong of the
right, right,
conversation, right? Like keeping people housed, as I started saying with that, because to me, that's one of the top priorities. We're seeing this insidious practice of displacing, for example, tenants without cause because of this. You may be familiar with this phenomenon of renovictions, where a tenant might be displaced without fault under the guise of renovation of their unit. But we've seen the case where a person is displaced. There's no major renovation, but then that same unit is listed at market rate, which is sometimes even 10 times above the rental rate that that tenant was paying. So I've seen it, I've witnessed it here in Imperial Beach. It is why we took action and implemented an ordinance to help uh, curb that practice and protect renters, help them land on their feet by requiring that the landlord provide at least 2 months of rent so that they could find another rental place and, you know, land on their feet and not become homeless.
right, right. Well, let me just ask one final question, and it's just a wrap-up question. It's just, what in conclusion, what would you like to share with the listeners, the viewers?
Well, that for my office, when we come District 1 supervisor, I want to make sure that the resources that we're using to address homelessness, to prevent homelessness, and to address housing affordability are done in an efficient, effective, and common sense way. Including, yes, it could be new programs, but yes, it could be looking at existing programs and what is working well and what isn't, and take a hard look at that and reassess. Um, and how do you do that? You do it by having accountability measures, and I think that's important. That it's an area that I would like definitely to explore when I become supervisor. Um, and that I look forward to partnering with you all on.
Oh, great. Thank you. Thank you very much. You've been very gracious with your time and with your responses, by the way. So thank you. Thank you. We'll be talking soon, I'm sure. God bless you.
Yes, sounds good. Thank you.
Thank you. Addressing homelessness in our community is absolutely critical. Thank you for joining me in this important discussion. God bless you.